All across Canada, patients and doctors are asking for change.
Doctors would know my name, not just my symptoms.
They would understand our culture.
We would be empowered to treat patients and teach students.
To leverage AI so we can improve our quality of care.
Through a bold new approach to medical education, the Toronto Metropolitan University School of Medicine is creating that change.
Attention hospital HR in Canada. Are you in search of the perfect insurance solution for your part-time and casual employees? Look no further. Meet Healthcare Providers Group Insurance Plan, your go-to option for ensuring the well-being of your team.
With healthcare providers, also known as HCP, you're not just providing insurance, you're providing peace of mind. HCP's comprehensive coverage includes medical, dental, and vision benefits designed to keep your part-time employees happy and healthy. There's even a package that includes life, long-term disability, and accidental death, disease, and dismemberment coverage for those who already have other group health and dental coverage.
It's time to bridge the gap between full-time and part-time staff benefits. With Healthcare Providers Group Insurance Plan, you can level the playing field and show your commitment to all of your team members.
Join the community of over 145 hospital sites who have made the smart choice. Visit healthcareproviders.ca today to discover how HCP can help you support your team in a meaningful way.
Is this thing on?
I think they can hear us a bit better now. Do you think they are ready to change the status quo?
It's one thing to get them listening, but now let's get them to act.
You are now about to witness the strength of nursing knowledge.
Welcome to the Gritty Nurse Podcast, an unfiltered discussion on health and healthcare. My name is Sarah Fung.
My name is Amie Archibald-Varley, and we are your hosts. Our Toronto Star and the Globe and Mail national best-selling book is available now. Get your copy of The Wisdom of Nurses today. You can get a book for purchase at any of your local retailers like Indigo or Chapters, or pick up your book online through Amazon or other types of retailers. It's also available in various different formats like audiobook and on Kindle. If you read it and you loved it, please leave us a review.
Please make sure you subscribe on our YouTube channel where you can watch our podcast in video format. Like, share, and leave a review. If you're listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, leave us a rating and review. Thank you to all our listeners and sponsors who continue to support us.
Your support makes our podcast possible, and we're grateful for the partnership and for you believing in our work here at the Gritty Nurse Podcast. Stay gritty.
Hey everyone, and welcome to another episode of the Gritty Nurse Podcast. We are your podcast hosts. I am Sarah.
And I'm Amie.
And we have two amazing guests today. We have Jessica Seitz. She has over 2 decades worth of experience in the healthcare industry. Jessica has worked as a labor and delivery registered nurse in the Tampa Bay area for over 21 years. And 2 years ago, she took the leap of faith and left bedside nursing for a career in comedic social media. With nearly 1 million followers, Nurse Jessica has become a trending social media sensation and is proud of how far she's come in such a short period of time. She is also the co-host of a nursing podcast called Nurses Uncorked, where her and her co-host advocate for nurses while still managing to insert humor in the mix. Jessica says that if she can give nurses even a little chuckle in the midst of their crazy, chaotic work lives, then she feels like she is accomplishing her goals. Welcome back to the Gritty Nurse Podcast, Jessica.
Thank you. Thank you for having me again. I'm happy to be here. Time flies. It's been a while since we were on the or since I was on the podcast. I'm glad to be back. Thank you.
Yeah, and in that time, you endured a hurricane, and which is kind of why I wanted you to come onto the podcast and share your experience. So it's great that you could come on again.
Yeah, glad to share it. We'll get into it. Yeah, for sure.
Okay, and then next we have Raluca Radu. She's a proud nurse with a Master of Science in Nursing from University of British Columbia, and she specializes in something really cool, climate change and health education. Since beginning her nursing career in 2014, she's gained experience in private and public healthcare, including surgical units, emergency departments, primary care, and occupational health and safety. Raluca has also taught as a clinical instructor and lecturer at UBC, contributing as a content expert in climate change and health. Passionate about the environment, she remains active in groups such as the Canadian Association of Nurses for the Environment, also known as CANE, and other planetary health initiatives. After serving as a climate and health educator with Doctors Without Borders, where she led capacity building on mitigation health co-benefits, Raluca joined Providence Health Care as its first Planetary Health Lead. She believes we all have opportunities to act now to protect our future. Welcome to the podcast.
Thanks so much for having me. I'm really happy to be here, and I can't wait to dive into a full chat with all of you.
I think this is such a timely episode, and I'm so glad that we have both of you to kind of share your unique perspectives. I mean, Jessica, like you went through a crazy hurricane, and then again, I think just for our listeners to know that nurses can be in any type of role. So even hearing Jessica, your story, we've had you on before, and then Raluca, like what, a planetary nurse? What is that? So actually, you know what? Why don't we start with you, Raluca? Because I didn't even know that this type of a role existed. Of course, it is definitely needed, but maybe you could tell us a little bit more about what does a planetary nurse health leader do?
Sure, yeah, and I know it's like terminology can get pretty abstract sometimes, especially since planetary health like stemmed in like the academic setting. I think over a decade ago, and I think where many people are still trying to make sense of how to apply it to real world like issues. But basically, I'm going to kind of tie it into like the definition just because I think it's so important to have kind of that foundation. So planetary health like refers to first how we kind of coexist with our environment, but most importantly, the relationships that we have and how, for instance, any human-induced activities can further degrade the ecosystems and biodiversity and contribute to the crises that we're seeing and living through today. So taking all of that and making it practical, basically my role is concerned with supporting kind of sustainability forward initiatives in the hospital setting, at least where I'm at, so in clinical programs. And it's about like that operationalization of taking the initiatives, taking a strategy, and making sure that I can help support the coordination of putting it into place. So I would say that at this point, the role, which is not new in British Columbia, there's other health organizations that already created this kind of positions. So there's quite a lot of alignment in these roles that have been created. But the core of it is to essentially support each health institution to implement the planetary health strategies or the climate and health adaptation and mitigation strategies as to how we prepare hospitals, our healthcare staff to respond to growing climate crises. So yeah, it gets from like abstract to practical. So hopefully that kind of preface helps a bit.
I think it really helps. Yeah, I think that when I graduated from nursing school, they said, 20% of the jobs that you will have don't even exist right now. And I think this is a perfect example because we never discuss climate change. I think this is something that's kind of new. Like it's just even the thought that there's an intersection between healthcare and climate change is a new thing for a lot of people. Go ahead.
I wanted to quickly respond to that because you said something that I think is so important for our listeners in terms of the intersection of health and climate change and healthcare specifically. Healthcare systems, like especially here in Canada, contribute to about 4.6% of the greenhouse gas emissions that are measured, at least on average. And so it's just knowing that like healthcare doesn't get a free pass. Like we're the ones who are providing care, but we're also the ones who are actually contributing negatively to the environment. And so that's why this has become such a prominent thing now to see across Canada, but also across the world.
Yeah. I was going to ask before we go to the next question, Jessica, is there a role like this out in Florida, or have you heard of roles like this out about where you're working?
No. No, not fair. Not that I'm aware of. I was like, wow, this is amazing. If they have, it's just been within the last year or so, and I'm not aware of it. But no, I've never seen or even heard of that role before, which, especially here in Florida and really everywhere. I mean, it sounds like it's becoming more and more needed, more important, just thinking of different ways of incorporating a different thought process so that this, we don't continue down this trajectory of global warming and all this other stuff. And shoot, the last hurricane I was saying that rolled through here literally scared the bejeebies out of me. I mean, that was one that I would rather not experience again, for sure.
Yeah, I was actually really concerned for you. I kept checking in with you, Jessica. Are you okay? Are you okay? And then
That's
you
so
didn't
sweet of you.
respond for like a whole day, and I started to get worried, but then you told me that you lost power, so that made sense. We'll get a little bit more into your story. I was just wondering, Raluca, just going back to you for a sec. We've been talking about this in kind of vague general terms. I'm just wondering, do you have any examples of climate-related health disparities that you've either observed or read about in some of the work that you've done?
Yeah, definitely. I mean, I think seeing them firsthand here in Vancouver in the Lower Mainland, but also reading about them and also working in that humanitarian space. So typically climate change, as is the case with many other social issues in our society, like tends to affect people who experience comorbidities, people who already live with infirmities, people who experience marginalization in society, or who experience homelessness are the ones who tend to see those impacts at a greater level. So just to give an example, in 2021, when we had that heat dome, when we had that extreme, like extremely hot temperatures for several days with no respite, that happened mostly on the West Coast and in Vancouver. It got really, really hot. During the span of that, I think it was about a 5-day time frame, about almost 700 lives were lost. And most of the people who sadly passed away were either people who were elderly or people who lived in social isolation, or of course who were experiencing homelessness and did not have access to like safe shelter, cooling abilities. And it was also during the pandemic. So there was a lot of fear for people who were homeless to access like cooling centers because of that stigmatization that they may experience, but also because of the fear of being exposed to COVID. So there were a lot of different confounding factors that were affecting people's access. So we know it's an equity issue. But sadly, like a lot of these events, like extreme heat, like flooding that causes displacement, tends to impact people in these kind of groups. We also know, like, not just from the literature, but even from like examples from around the world, especially in low and middle income countries, women, children, and the elderly, especially women in places where they're responsible to like gather fuel for the household, or they spend more time, for instance, if they're cooking on those stovetops that generate a lot of like air pollution, these kind of populations tend to be exposed to the worst elements. So really bad air quality that contributes to a lot of long-term, like short-term and long-term lung disease. And that also predisposes any, if they're pregnant, for instance, so they're unborn children, and when their babies are born as well. There's a lot of different ways in which climate change affects individuals. And I think it's really essential to note that people who fall in these groups, and I also wanted to add that like in Canada, Indigenous peoples are a group that are very impacted as well, because in the northern parts where like permafrost is melting and they're experiencing more and more displacement, or if there's like exposure to poor air quality because of like very polluting industries like mining or the burning of tar sands, those individuals, again, not only are they sacredly sort of connected to the land, but you've got these disruptions that cause substantial like mental health impact. So yeah, you could pretty much dissect this in so many different ways. What I'm kind of hoping for people to take away is that it's really an equity issue, and there's no known borders in terms of who climate change can impact.
Yeah, I think that you kind of hit the nail on the head. And again, just even thinking about our role as nurses, and even just thinking about it even on a broader sense, like there are so many intersections, like you mentioned, the whole aspect of health equity and the folks that are harmed, or folks that are unhoused. Again, there's these several themes that come through in terms of the health disparities that we see, particularly in relation to climate change. And I would say that I don't think a lot of people actually think that way. Like I don't think people connect the climate necessarily with health disparities or poor healthcare outcomes. And I think this would be actually probably a really good time to even for Jessica, for you to probably share your story. Like I know we have questions back and forth with Raluca, but I feel like in a sense that it might even make sense for you to describe kind of what you went through, and kind of with the hurricane in Florida, because it was huge. It was a huge news event. But again, we didn't really hear about, the connections or intersections that there might be with health, more just about like, okay, hunker down, make sure you don't lose your house. But again, concerns about, hospitals and healthcare staff and some of the tweets that I saw you say. So maybe you could share your experience with being a nurse who's out there dealing with a huge, act of, the environment in the world.
Yeah, sure. Living in Florida my entire life, it's, something that I've come to get used to and come to know. But, and I don't know how many people are aware, but, hurricanes are fueled obviously by warmer waters, warmer temperatures. It's kind of what they thrive off of, that fuels the hurricane to get more and more intense. They typically don't survive well in cooler water temperatures. So we've seen this progression, as they're saying, that the ocean waters are heating up. That not necessarily the number of storms, but the severity of the storm seems to definitely be kind of correlating with that. So,
Right.
I would say, I've always dealt with, especially, in nursing, it's something we prepare for every year in the hospitals. We all have to put in our hurricane evaluation forms that we have to do every year, where we kind of state if we, is there anybody you're responsible of taking care of? Are you going to be available in the event of a disaster? This is just kind of like a way of life for us. But I feel like this last year, is the first year that I actually was truly scared. For whatever reason, I've kind of been fortunate. The storms have either seemed to have gone north or seemed to have gone south, or the intensity wasn't. I've never seen such a rapid intensification of a storm like I did this year. I mean, it literally was not a hurricane, and then it was basically a Category 5 within hours, which is crazy to see a storm fuel up like that. So to know that the path was coming our way, I mean, literally for a while they were saying it was going to go into the Tampa Bay, which would be devastating. Now we've got a lot of hospitals, right? Obviously along the Tampa Bay area, we've got one in Davis Island that just is literally on an island. That hospital has taken over the years, it has a lot of precautions. Like it's got almost its own blockade, if you will say, so that it prevents it from storm surge. But the other hospitals or clinics or facilities are not fortunate in that sense. Like that doesn't exist. The one there that's Tampa General that is on Davis Island is that they're like that because they're literally on an island. And the scary part about that is, obviously it impacts everybody. Like it's not just it's like what I call it is it's like a moving shuffle. Like you have to figure out, okay, what are we going to do with all these patients that are in the hospital if it starts to flood? What are we going to do if we lose power, even though we have a backup generator? What are we going to do if we've got to move them up, or we got to get them out, or we don't have water, or we're going to have backup water here for these patients? Like there's so many moving parts. Then you have to think about the homeless community. Where's the homeless community going to go? Where are we going to put them? So it's like a revolving door of I don't want to say robbing Peter to pay Paul, but there's so many moving parts. You got to get the kids out of the schools because, well, you want them to be safe, but then there needs to be shelters for people to go to. So it's like this whole moving part and moving aspect. And it literally is like, I think what I saw in this last hurricane was truly fearful. The amount of water that came in and devastated people in their homes that didn't think it was going to happen, that had people trapped on their roofs, that injured people. So when I say it's like a multitude of moving parts, it's like you're trying to care for these people that are in these hospitals, possibly get them out, but then you've got other people now that are injured that need to come in. And it's truly, truly scary. I was fortunate in the sense that at the last minute, the storm went slightly more southern, but we still had, devastating effects here. I mean, even 2 miles down the road from my house, there was an apartment complex that only 2 miles away, that all the people had to get up to the roof because the entire apartment complex flooded and the waters were rising. And that's not something that was even anticipated, but the water just has nowhere to go.
Right.
It literally has nowhere to go. So I did stay in place at my home, which I know I talked to Sarah about that a lot. It was a lot of people weren't happy about that. You know, it's a hard thing to describe. And when you've lived here as long as I have in Florida, and you've kind of gotten used to navigating these types of storms and trying to make a decision as to what to do. It's like, I think people forget all the other moving parts of, you know, I have a husband that's a physician that he was required that he had to go into work to work for the hurricane. So I didn't have him to help me to just pack up and leave. I had his grandmother that I was responsible for, who's in her 80s, that you know, isn't the most mobile of people, you know, that I have to think. Then I have two dogs. I have a cat. I was watching birds. I've got my children. I have, you know, and everyone's just the traffic to even get out of the town. You could possibly be literally stuck in your car as the hurricane is hitting.
Yeah, that'd be disastrous too.
Nobody was moving. There's no people like, oh, go to a hotel. There's no hotels. They're all booked. What hotel do you want me to go to? Unless I can make it to Georgia, where am I going to go? You know, and people don't realize that. So you have to kind of make a conscious decision, you know, what is going to be best for my family? And could I have possibly picked the wrong one? Maybe. I didn't, thank goodness. We chose the right one. But, you know, you've got to, now, if I was one of those people on an island, there's no way I would have stayed. I mean, I'm not, I know storm surge and I know what it can do. There's no way I would have fought for whatever I had to try to get out of the area. But I was lucky. I was fortunate. We lost power. We had down trees, down, you know, power lines. We had a huge mess everywhere. I was only without power, you know, like 36 hours, which in itself sucks. But I was very, very fortunate. But I did see, you know, a lot of people deal with, I could go on and on about this, talk y'all's ear off forever. But there's just so many moving parts that go into this. And I'm willing to answer anything else you guys want to know, but there's just like a million factors that.
I was just really angry at the comments you were getting, Jessica, about why you didn't leave. And I think a lot of these comments are just kind of ignorant. Like you just explained to me some of the reasons. I'm sure there were a lot of other reasons why you couldn't leave, or just why the average person wouldn't be able to pack up and go. But people must have thought that the roads were empty and people just have unlimited amounts of money and there are unlimited amounts of hotel. And why don't you just drive to the next state, right? Like, I don't think people are thinking when they make these kinds of comments.
They don't realize, especially if you don't live in Florida, or, you know, or even some of these other coastal states that have dealt with it before, and especially a magnitude of this storm that came so quickly. And it was like all of a sudden it's category 5 and people are panicking and everybody's hitting the roads. People just speak before they, you can't just hop on a plane. I mean, they're not, the flights are getting canceled. Like, it's not as simple as people make it sound. So in all honesty, those comments don't bother me because I know it comes from just lack of education or being naive. And, you know, it's a choice. It's a decision that you have to make. You know, you have to weigh out your flood zone. You have to weigh out, you know, are you in a really sturdy home? You know, when was your home built? Do you have hurricane shutters? You know, there's a million different things. So, you know, and, you know, in Florida, what we do is we have a storm, we hunker down and we have fun. What else are you going to do? You know, I mean, we make hurricane parties. That's what Floridians do. So you decide you're going to stay, you might as well drink and eat and live it up. And that's what we did, you know. And I think a lot of people took that as making light of the situation, which it's a coping mechanism for Floridians. People don't get that, but that's, unless you've lived here, that's just how we handle it. That's what we do, you know?
Yeah. And I think you touched on another really important aspect is, again, like as nurses and healthcare professionals, like your husband, if you're working, you have to go to work. Like there's no way around it. So if you're stuck and your husband has to go to work, I mean, people being judgmental online, like, I don't know, to me, I'm just like, I don't read the comments, but there's some other practical aspects that, for example, if you were working as a nurse, as an L&D nurse at that time, and you had a shift, you would have to go to work. So again, there's those other things that we have to account for. And again, for me, the noise is just people making noise, just talking to talk because they can.
Yeah. And a lot of times I just stop reading the comments and just let them have their, whatever they want to say. Just let them, you don't know what you don't know, I guess. And there's always keyboard warriors out there that love to stand behind the keyboard and say things that they wouldn't say in person. And I get that. So just let them have their fun, and then they boost my video up more by making comments. So.
Yeah, you said that too, and I like that. That's a good reframe. You mentioned a lot of things that the hospitals do to prepare for hurricanes, and like it sounds like a lot was kind of in place already. Do you think that there are more things that they could be doing just in general to prepare for extreme weather events?
I mean, there's a lot of stuff that I think needs to be worked on, even just little things like being prepared for if you were without electricity, downtime forms. We're so like dependent on electronic medical records, and, it's just a thing that we're used to. And I don't think that enough training is spent on how to really go back to paper charting if you need to do paper charting. How do you get some mobile emergency ventilators to work if things go down? Like, I feel like there needs to be more implementation of yearly education surrounding those types of things. I mean, like even something so little as you would think to go to paper charting, people freak out. Like literally, they freak out. How do I get somebody in the system? How do I get them admitted? How do I what do I go? Where how do I put an order in? How do I get it to the pharmacy? Like, these are things that people should really be trained on and know how to do in a situation, even places that get cyber hacked, and their systems are down. It's the same kind of thing. It's like people go into panic mode. So I think, packets of downtime forms ready to go. People understanding like, okay, what if we can't flush toilets? What if there's no water? What are we doing with all this waste? What are we doing with the staff's waste when they have to go to the bathroom? What are we doing with the patient's waste? Little things like this are all things that need to be pre-planned and prepared for, so that when the worst happens, which hopefully it doesn't, that people can really be able to kind of take action and do things safely and in a timely manner instead of, panic mode. Like the nurses, I think, that were up in was it Tennessee? I'm trying to remember the nurses that all had to evacuate up to the roof during Milton when they were not expecting, these flood waters. Like that hit these people out of nowhere. Like there was no way that they could have anticipated that they were going to have, a dam, break, and then everybody's having to rush up to a roof. But these are things like for emergency that it would be great that if they did like a yearly something to kind of, or even twice a year, to get people acclimated to going back to the basics, going back to if we didn't have lights, if we didn't, how would we navigate? How would we do this and keep our patients alive and ourselves alive? Because that's the scary part is, we know to take care of patients. That's a no-brainer. That's what we do as nurses. But dealing with the panic of worrying about yourself too, on top of that, it brings a whole nother dynamic into that I think another thing that people don't really take account for.
I was thinking to myself, Jessica, as you were talking about all the various different codes that might have been called at a hospital, because like, for example, like let's say there was a massive event that happened. And I don't know if the codes translate between Canada and the US in terms of some of the ones that we have, but like, for example, like, a code orange where you might have multiple patients coming in because of, maybe because of the storm or because of an accident or something that occurred, or you might have a code gray, which here would be, your downtime, your tech isn't working, and how all of these various different things as a nurse we'd have to be taking account for, right? I think how disturbing and scary it would be to be one, having to receive care, and then two, having to make sure that we deliver care, especially if we don't have all the things outset for us. And I was going to quickly ask you before I go to you, Raluca, is there actually like a specific code for, like, well, I mean, I guess it would be considered like an external disaster, but do you have like a code like that in Florida for for
like
storms?
a code hurricane or something?
Code hurricane.
No, I mean, we have the disaster code,
right?
and,
Disaster.
all of that. Yeah, but no, we should, but no code hurricane, as of yet. But, I think just in, God, there's so many different things I'm just thinking about. Like, just for a second, I was thinking about staffing and staffing issues, which it sounds so silly to bring that up. We're talking here about climate change and all of that, but having even just the ability to have the staffing upped in an emergency like this. You think about, okay, if you need to get something, for example, you need to get meds from pharmacy, you need to have extra staff to be able to run to the pharmacy, to get the meds, to bring them back. Like, there's so many different little things. And I still think that that's something that obviously hugely needs to be worked on, not just on a daily basis, but even in the event of emergencies coming in. To have staff on call, I don't think is enough. I feel like there needs to be people there, because it's like all hands need to be on deck. And I don't think we're quite at that level of that yet either,
Yeah, I mean that's a fair assessment in terms of just the state of nursing. We just have issues generally with staffing, and again, I have my ideas on. It's not just that there aren't enough nurses. I do feel like management leaders do not adequately fill their teams by whatever reason, whether it's budgetary or whatever. But it's hugely problematic, particularly when there are those instances of emergencies.
Attention hospital employees and retirees in Canada. Picture this: a benefit plan designed for casual and part-time hospital employees and retirees who aren't covered by their hospital's group health plan. Introducing Healthcare Providers Group Insurance Plan, a friendly partner dedicated to your health and well-being.
With affordable plan premiums and an exceptional support team, Healthcare Providers, also known as HCP, is dedicated to helping you every step of the way. Enrolling is easy, and you'll have access to a wide range of health and basic dental benefits from day one.
Already have health and dental coverage through another group plan? HCP still has your back. For less than $32 a month, the Signature Package, which includes life, long-term disability, accidental death, disease, and dismemberment, provides valuable income protection and peace of mind for the unexpected.
So take charge of your healthcare and financial security today. Visit healthcareproviders.ca to learn more. Raluca, I want to pull you in here because I think we touched on all of the very practical things that are happening kind of in the moment. But what about kind of pulling ourselves back and thinking about, policy, how we can better, as healthcare leaders within this field, really address these climate issues effectively, and thinking more about the aspect of, sustainability within healthcare. What might this look like, with your particular role? How would you see sustainability? How can we, ensure that, nurses are staffed up for these types of climate emergencies, knowing that they might be coming? Or, what are some of the policies that we can see and design to address some of the issues that we're seeing?
Oh, I feel like there's so much I want to say. And first of all, I'm just so grateful to Jessica for just painting the picture. Many ways, many things that you've shared, Jessica, like there's things I have not gone through. But I cannot imagine to be mentally in that place and to really pull yours through, really try to categorize in your head, what am I doing? What do I need to do? And what is the decision making I'm going through, if I'm home? And I just wanted to recognize that. I think it's so important to hear that story. On the preparedness side, I think there's multiple facets in terms of when we talk about adaptations. So how do we kind of prepare ourselves for what's coming, and mitigation in terms of how do we operate with the least environmental footprint, but in a way that kind of prepares us for what's to come. And then there's that resilience factor in terms of like having the mentality to be able to kind of like anticipate the risks and to know the risks for your region, whether it's a geographical like implication if you're living in an urban area. And we know in Canada, like because there's so many communities in the urban, but also like the rural and remote, there's totally different considerations for hospitals that are operating in like interior BC or like northern, Canada versus like what that picture would look like in the urban setting. So I wanted to make sure I mentioned that because what I might say now might not necessarily apply at that level because of resource scarcity. I think that first of all, I mean, I want to say that preparedness starts in the hospital, but preparedness should also start with how we're training our healthcare staff. So all the way back to undergrad, graduate level education, both of those should be able to integrate components or courses that address what is climate change and like what does that look like for sustainable healthcare systems. And it's something that is being worked on in the background, but we're not like I don't think we're not at a point where I can say on this podcast that this, in Canada, this school has made this course mandatory. Like I think we're still at that point where we have electives. It's like, okay, electives are nice, but not everyone can take them. We know that because we have that pressure to want to prepare ourselves clinically for working in like different specialty areas. When we think about the hospital, I think it's really important to do like risk assessments. So now in the Lower Mainland in Vancouver, all of us health institutions that have signed on to have these strategies, we're looking to do comprehensive risk assessments, I think on a fairly regular basis to see kind of like what is the building envelope like for each hospital or health facility or long-term care home? Where do we need to kind of like upgrade? How is our heating and air cooling sort of ventilation system? Do we need to make changes to that to make sure that it's able to withstand like potential extreme temperatures, or if there's like extreme wind, like what is our backup plan? Exactly as Jessica was suggesting in terms of like what is your protocol when it comes to downtime? And then when it comes to like the policies, I think that really having and co-creation, I think that's a key word for me, is like making sure that staff are a part of those conversations that often happen at the higher level or happen kind of like in silo. I think here in Vancouver, I want to say that we're doing a much better job in working with like clinical program directors from different departments to make sure that the protocols that we have in place are known to people. But I would still say that emphasizing on this and making sure you have like annual exercises, maybe you have to run through some simulation exercises with staff to know like what would you do in this scenario, and make sure that everyone on that team knows their role and responsibility. So I think we need to have solid policies in place that abide by that and make sure that staff understand like where to react and where to pull back. And I think that preparedness mentality is, I don't know, sometimes I get the sense that people don't take it seriously because if they've never been impacted by something, it's so distal to them that they can't wrap their head around it. Like even this book I'm reading by George Marshall, I think it's called like Why Our Brains Are Wired to Ignore Climate Change. And he goes around in the States actually and like talks to people who are like don't believe in climate change. He tries to approach them with curiosity to try to figure out what mechanisms could help break those silos down and help bring non-believers on the believer side. And it's interesting how it's all about communication and it's all about moving away from sensationalism media to like bringing more like real stories spoken by people who maybe are survivors and like really breaking things down in like lay language, not speaking at that high level climate terminology that many people just can't connect with. And it's also making it a part of that understanding how it's affecting people on a regular day. Like maybe you're living in a city that the air quality is not very good, but it's just for me to help you. Like as a nurse, my job could be to teach you how to use the air quality index and how to interpret when it's safe to go outside and when it's not. And I think one of our biggest roles as nurses, I think is really I don't think maybe the four of us, this doesn't apply to the four of us, but like in general, I think that nurses are kind of not confident enough to believe that they're really good communicators because I think they are. I think they do that job perfectly in the hospital, but I think like feeling comfortable to step outside that hospital or clinical practice and think, how would you engage with media if like media gave more channels for nurses to really share Like, what is a tip you want to share with a patient or a community member? And I think it's owning that and knowing that you have the critical thinking, you have the expertise, you just have to kind of like step outside that comfort zone. And maybe again, it comes back to that education space where we're not taught how to engage with media, we're not taught business skills. So how can we make sure that we revise education and like practice settings to give nurses these skills that going forward will pretty much be imperative, so that that way the scope of health professionals who are being interviewed is widened, and that nurses are more visible in these like highly prominent spaces.
Yeah, I love that, Raluca. Like, I think that it's critical that, you know, one of the pieces of our work in terms of nursing and advocacy is also education, right? Like, we go through our checklists when we're discharging our patient, and how many times we hit that there should be some form of education about this, education about that, education about this, like, you know, whatever we might be teaching, but we don't, you know, when we're leaving the bedside, it's like that all of a sudden is gone. And it's like, no, we have a duty, like you said, to have these conversations outside of these walls, right? To have these conversations and to be a part of, you know, talking about how it might affect someone's health, how, you know, these various different determinants and things related to climate can really, you know, change someone's, you know, healthcare outcome. But you're right. I don't even know what else to say other than the fact that we don't have, a lot of nurses don't have these skills, don't feel that they can, or I should say, don't have the skills, don't feel that they can translate them in different mediums, like to the media, writing an op-ed or anything like that, right? And I feel like we are in that space where we have the ability to do it, but it's like breaking people out of their shells, or, you know, or empowering nursing schools, like you said, to kind of have more of a structured environment where we feel that we're empowered so we can have these conversations and be a part of that change. I think that we're starting something. Nursing schools out there, are you listening? We need to talk about climate change, and, you know, we need to talk about how nurses can be a part of the conversation outside of our traditional roles. And I think that, you know, there's work that needs to be done here. So I'm excited to see what might happen next in terms of where we might go. So I'm going to throw this to both of you in terms of pressing issues in terms of climate. Maybe in the States, we'll start with you, Jessica, and then we'll go to you, Raluca. What are some of the most pressing issues that we might need to know in terms of, you know, climate and climate change, and how as nurses we can be a part of, you know, something greater? And what do other people out there need to know?
Oh, well, you know, I like this question, you know, and the fact that, you know, Sarah and Amie, that you guys are doing this podcast is great, because it sparked a conversation between me and my husband, you know, a conversation that I wouldn't have had before, you know. So with him being as an OBGYN, I kind of phrased this question to him earlier this morning as we're laying in the bed, and, you know, he made me think of things in a different way, you know, like, I think for a long time, and it's very important, hospitals, you know, their focus is on, you know, sterility and keeping things clean and trying to, you know, maintain aseptic technique and all these different things. But as times are changing, and, you know, the climate is changing and things are getting different, like, I think that the mindset might need to be changed slightly so that we make adjustments. And this is the example that he gave me. He said for the longest time, if a patient needs a speculum, we use a sterile speculum that's re-sterilized, you know, in the autoclave and all of this, right? Years back, they decided that they were going to change this because they didn't like the idea of transporting a speculum back in like a paper container back to being autoclaved. So they had the great idea, we're going to come up with disposable plastic speculums, okay,
Right.
which are ultra expensive. And, you know, I wasn't thinking, you know, obviously how are plastics made? Plastics are made, you know, from fossil fuels and natural gas. So my husband phrased it to me this way. He's like, there's landfills of hundreds and thousands of unnecessary speculums that we're just tossing away per patient, when what we really should be doing is decreasing the amount of things that we are actually, well, sure, it's great. It's amazing that we're not transporting this tool back to the OR to be sterilized, but now we're contributing to, you know, increasing the climate, and, you know, and I'm like, wow, like, it really is a different way. I think that we just need to start looking at things in a different way. And I'm not saying oh, let's just throw out, sterility. And that's not what I'm saying, but we need to come up with a balance, I guess, maybe more so between those two. I don't know, for Raluca, if you agree with that, or like you can add on that.
No, for sure. I mean, I think everything you said resonates. And I think I didn't capitalize on this enough, but I think that at the beginning of the podcast, I mentioned how much percentage, so about 4.6% of emissions are attributed to healthcare facilities. And so how we operate, understanding that sustainability is about operating with resources in a very mindful way, in a way that, first of all, does not contribute to further fossil fuel burning, especially when we think about fossil fuels and the impacts of like coal, gas, and thinking about how we're shifting towards energy sources that are cleaner for the environment. And that also means internally in the hospital, how are we kind of tapping into equipment, supply procurement in general, in a way that is with that sustainably conscious hat always on. And it does require a lot of conversations and a lot of probably policy shifting internally with all those different departments that are affected or that are at the intersection of making sure that your equipment for surgeries is available, but what is it that you need and what is it that you don't need? So, making sure that you only take what you need rather than that thinking that resources are infinite. But one other thing that I wanted to say is that and for Canada especially, but I'm sure that many of these lessons are probably applicable all around the world for healthcare facilities. Takes me back to the Lancet countdown. So the Lancet countdown is kind of like that academic report that typically comes out annually, and it's very evidence-based, and it's essentially a really wide look at the current sort of climate and health aspects that are happening, all the research, and consolidating that into themes and then recommendations. So for Canada, I was kind of looking at it again to refresh my mind, but they came up with these three sort of focus areas. In that one, it's making sure that all our healthcare systems are resilient and are able to adapt. And to actually be able to do that, one thing that they actually commented on is making sure that health practitioners, so regardless of designation, whether you're a nurse, physician, allied health, that they're seen as advocates for climate action. And that comes down to like having education, having training, building capacity to make sure that clinicians understand how to communicate this information as well to patients, but also having health practitioners be advocates for making sure we shift away from fossil fuels, because we know we have trusted voices in the society. So it becomes a little politicized, right? Like in that we're now requiring health practitioners to speak up to make sure that we shift away from that. And then there's also a lot of push to have healthier diets in our hospitals. There's a lot of cool projects that have happened locally here where different clinical teams are actually trying to re-envision patient menus so that they're actually more nutrition forward, more culturally appropriate. So they're also co-designed with patients. I have examples here in the Lower Mainland where they are also working with like Indigenous restaurants and teams. So people who can bring that land-based access, but in the hospital, especially for people who identify as Indigenous when they're being hospitalized. So I think it's just a lot of, when we talk about pressing issues, the biggest one right now is really shifting away from fossil fuels and having healthcare facilities that are operating through more renewable, clean energy sources. And then the second is just this real need to educate, an education that is ongoing, that doesn't just stop, because we know that we can all play a role. And I think we just have to do a better job in bringing this conversation to healthcare administrators and people who have those executive level authorities to be able to give respite to our clinicians who are still facing burnout, not just from the pandemic, but from the competing priorities that continue to exist and the pressures that are placed. I think one thing is that rather than seeing climate change and extreme weather events as kind of a separate sort of aspect that, oh, it's just another thing that I'm going to add on your agenda, I would actually say that it's not. It's embedding the understanding that when we have systems that are prepared, when we have staff that are educated and feel comfortable with like knowing their roles, it's already kind of part of the business as usual situation. So making sure that it's just not seen as an extra part of the job, but rather just embedded right through our responsibilities. And it comes back to that duty to protect and duty to do no harm. And it's yeah.
I agree with you 100%, Raluca. And I think that a lot of times in healthcare and hospitals, we're very reactive and not proactive, right? So we wait until there's an extreme weather event and things kind of hit the fan. And then we say, okay, we need to now put together a committee or we need to have a policy. But really, we need to be thinking about this. And I don't want to politicize global warming, but whether or not you believe it, the fact is more of these weather events are occurring. They're not going away anytime soon. So we need to be prepared for it. And I also feel like it starts from the top down. So if governments kind of prioritize this, if healthcare leaders embedded this into orientation, nursing schools, then it wouldn't be such a foreign concept to where we have to convince people that there is a correlation between climate change and healthcare. So I'm just wondering if I could ask each of you one last question. Start with you, Jessica. Do you have any advice for future healthcare professionals regarding how they can integrate climate change into their practice, or how we can kind of advocate more for climate change initiatives?
I mean, I would just say, think about maybe the things that you're using in your day-to-day practice or in the hospital, thinking about where did they come from? How were they made? Is there a better way that we can do this? Is there a better way that we can still provide for our patients safely, effectively, but at the same time improve upon, possibly reducing the amount of plastics that we're needing to create or anything. And like Raluca was saying, bring those ideas. Don't be afraid to bring those ideas up, maybe to your administrators or different people, there in the hospital. And I would also say, in talking to future healthcare workers or current healthcare workers is, while a lot of these mandatory trainings and things might seem redundant or silly, or the chances that we're going to need this are slim, maybe just taking the mindset and thinking for a moment, when you do need it, you really, really need it. And that's why these kinds of things are important. So go in with an open mind, I would say, about, practicing things that may not happen on a day-to-day basis, because in practicing that we get more comfortable, and so that when we are in an emergent situation that we're at least can pull on that little bit of training or something that we had, so that we don't feel completely like a duck out of water, that we don't know what the heck we're doing, or where is a downtime form, where do I go? What do I do? Just trying that. And don't be so resistant to maybe do some places. And I think it's great, we'll purposely do an hour or two of downtime, to try to get people used to that. Now, some nurses will try to skirt that and just write things down on a notepad and then know that they're going to be able to go back to the computer. But to open your mind and really think about, if I was not going to have that computer pop back up for me in 2 hours, how would I really be able to convey and chart that I took care of my patient the right way, so that somebody could look at these records, later on and know that I took care of them, that gave the meds that I needed to, and just go into it a little bit more open-minded, so that we can all try to push things into a better positive light, a forward light, so that we're not contributing further and further to destroying our environment,
Definitely building off of what Jessica said. I like, even when I taught, and sometimes now, like in healthcare, when I'm meeting with my colleagues, I try to bring that three-tiered way, so that individuals, so micro, meso, macro view, so that people can see that any level of action matters. Because oftentimes if I ever get resistance, it's, oh, well, if I do, if I change this tiny little aspect, like how is that going to make a difference in the larger scheme of things? But tiny little pieces of action will build a ripple effect. So just saying that it's a very, both upstream and downstream kind of approaches are important. So from the individual level, when we think about more of that grassroots initiatives, I think it's great for people who are maybe new to this topic or just new to the conversation. Like in the States, I know there's the Alliance for Nurses for Healthy Environment. So Amie, that is a really fantastic colleague for us. The counterpart here in Canada is Canadian Association of Nurses for the Environment, as you've stated in my bio earlier. So these are really two great associations that are by nurses for nurses. I know we work closely with Annie, and like Annie has a textbook I think that's available for free online that talks about like the intersection for nurses and healthy environments. So those are good places to start kind of building a little bit of knowledge. And maybe you want to join a call. They have like monthly and sometimes bi-monthly calls on different topics. And then global institutions like Planetary Healthcare Alliance, or sorry, Planetary Health Alliance, if you want to subscribe for newsletters. So I think first starts with that, familiarize yourself with what are the pressing issues. And then maybe through that familiarization, you'll find a topic that is really interesting for you. Like maybe you want to expand your knowledge about vector-borne diseases and you want to figure out like, how do I get involved in my community about this? The meso, the community level is that both where you're living, so your family, your friends, and your community, but also community, I think of it as like my hospital team. So what are the kind of initiatives that I can get involved with? So maybe as an action item for our listeners, I could say next week, when you're back to work, you can ask your hospital, like, do we have any commitments that are made to, divesting from fossil fuels or for embedding sustainable in our practices, or do we have a green team? So that could be a good conversation starter. And of course, I could go into a myriad other kinds of examples in terms of just starting the conversation, I think, is a really first important step. And then even asking your colleagues, is this something that interests you? Because once you start identifying a topic that's of interest and you start building sort of that collective caring about an issue, it's easier to face administrators in terms of like going in together and saying, hey, look, Sally, Tommy, and I like all care about this. We'd love to start a green team. What do we need to do?
Right.
And then that really macro level, which I think this is the one that for many people is distal because it's that policy level, that systems, that governance level. I think that if you're part of organizations like Kane, like Annie, or even Healthcare Without Harm or Practice Green Health in the States, which again, like there's a lot of amazing examples and colleagues we work with from the States, is how do I join in those organizations and how can I help? I know for some, like maybe it's signing a petition or maybe it's showing up in front of like government and like demanding for change, but there's different ways to become engaged depending on one, your level of comfort as to where you want to be. And if you want to be at that, that community level, that's more than enough. But if you want to start somewhere, definitely try to take a moment to reflect at the individual level as to like, where do I sit with this? What matters to me? And how can I use my knowledge, my skills in a way that can help me kind of start to make a difference incrementally on addressing climate change and on making sure that my practice aligns with sustainability and is embedded kind of as a whole. And maybe in a way through my storytelling, comes back to the communication piece. How do I make sure that my patients are also prepared to face the impacts? How can I relay this information to them in a way that I know when they leave the hospital, it's not just about taking care of that post-op wound, but it goes beyond, in the summertime during like storm surges, like what are the key pieces of information that I could relay before they walk outside the door? So
I think that, we learned so much from both of you today. I think this is a great discussion. I'm sure we could keep going and have a part two. I think that'd be awesome.
Before we close out, I really love, Raluca, how you touched on those various different levels and how people can be a part of, the change, whether it's on the meso level, the micro level, meso level, or the macro level. Like, I think that's such a perfect way to outline where we can all align ourselves. And as much, I always say healthcare is political. I am a firm believer that if we aren't involved in policy and we aren't involved in part of those greater changes, that we can see, some of those detrimental effects, like you mentioned, from a health equity perspective on, our patients and families, the same people that we care for and we serve as nursing and as a nursing community, that again, we have to listen to the policies and decisions that our governments are making in relation to climate, energy, and healthcare. So again, thank you both, Jessica and Raluca, for coming on the Green Nurse podcast. Sarah, you can take it away from here.
Yeah, just real quick, Jessica, do you want to share where people can find you? And then Raluca, you can go next.
Sure. I'm on TikTok, Instagram, Facebook, YouTube. Everything is at Nurse Jessica Sites. SITES, and our podcast is called Nurses Uncorked, and you can find our podcast on anywhere: Apple, Spotify, YouTube, all that good stuff.
Oh my God, that's amazing. I wish I had all of that, all those channels. The only two channels that I'm currently present on is LinkedIn, which is just my name, Raluca Radu. And then well, I guess I keep saying Twitter, but for X, it's at Raluca Radu or at Raluca R. And I'm always open to being connected. Typically, I've had a lot of contacts with people on LinkedIn. But I am perusing for the future, like how can I amplify and tap into the media channels more. So yeah, stay tuned.
Yeah, you join Blue Sky. I think the skies are bluer over there. But yeah, so thank you both for coming on to the Green Nurse podcast. Such an engaging conversation. And I think that we should maybe have more conversations about climate and these various different things. I think, with the coming 2025, there'll be many more conversations about the different impacts on climate change and healthcare. So definitely stay tuned, and I hope to have you both on to continue this conversation as well. Thanks so much.
Thank you. We're glad to do
Thank
it.
you.
Thank you for listening to the Gritty Nurse podcast. If you have any suggestions or want to hear a specific topic, email us at grittynurses@gmail.com. That's grittynurses@gmail.com.
We are also speakers and authors available for engagements related to advocacy, nursing, mental health, and health policy. Please connect with us.
We want to take a moment to express our deepest gratitude to our incredible sponsors. Their generous support has been instrumental in making our podcast a reality.
Thanks to their belief in our mission, we're able to bring you engaging content and connect with our amazing community. We're truly grateful for your partnership. Thank you.